Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwonitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Welcome back to Between the Sheets. I have an amazing urogynecologist on with us today from Beverly Hills. I have Dr. Alexandra Dubinski here, and she is going to talk us through some female sexual health stuff. Thank you so much for being here. Welcome.
Thank you so much, Stephanie, for inviting me. It's my pleasure to be here.
Yeah, absolutely. Absolutely. So I love that you focus on women and obviously everything gyno, uro, all the things in between, but specifically you really help women with their sexual health and kind of overcoming some of the difficulties there that we experience as women. I'm really excited to talk about kind of the arousal cycle that women go through because a lot of women struggle to be ready for sex, to desire sex, all of that. But there's a reason for that, right? Like there's this cycle we go through.
Absolutely. And what's interesting is it's a little different than what men go through.
Okay.
And not that many years ago, when it was predominantly men who were studied in research, they discovered that there are like a few stages that the men go through. And the assumption was that the women, just small men, so they probably go through the same stages and it just takes them long.
Yeah.
But now we know that women are a little bit more complex. So for us, it's not just like one stage after another. For us, it's more like a cycle. And we can jump on that cycle at any point, and we can jump off that cycle at any point. And just to make it a little bit easier to talk about it, we can talk about it in stages, right?
Okay.
Because usually, like, we start with desire. And I see a lot of patients who come in and say, okay, I don't have any libido. It's very common. And when we assess the libido or any issues with arousal or orgasm, we always think about the issue from biopsychosocial model and what it means in English. It basically, there are different aspects of our life affect how we respond on sexual stimuli. And those aspects are biologic, like what's our state of health are. Are we having diabetes, chronic heart disease? Is it difficult for our body to exercise, not even talking about sex? Is there any surgeries that were recently person underwent, which would also affect the way how we respond and what's our state of health is. Also, mental component of it. Yeah. Are we depressed? Do we have anxiety? Do we have any like fears, any past like sexual or just emotional trauma? Also, what's going on with us socially? Meaning, is there any issues with our partners? Are we going through recent like loss in a family? It's all going to affect the way how our sexual health goes. And also the way how we brought up, our religious beliefs, our cultural upbringing will affect our sexual desire, arousal, and orgasm. That approach, this biopsychosocial model, is used for all sexual issues, basically. Okay. So if somebody comes in and says, you know what, I don't have a libido, I always evaluate each of that domains. Is there is anything medical going on, social, if there is any changes. And it's very important to understand where person is in their like current life. Meaning, if you just had a baby and you sleep deprived, and you're so exhausted, there's all hormonal shifts. It's normal to not want to have sex. Or if you're going through a stressful situation, like taking like your finals, there's a lot of things going on. It's normal for your mind and body to shift and focus on what's your current life priority.
Hmm.
And it's normal. It's normal reaction. There's nothing abnormal. And in those cases, you just educate person, reassuring that, it's okay. When this
Hmm.
situation changes, libido will come back.
Okay. That's gotta
Another
be nice
important
for some ladies because that's gotta be, like, reassuring, like, "Okay, there's nothing, like, overall wrong with me, I just need to kinda, like, work through this phase, and then I'll kinda get my mojo back and feel kinda normal again."
Absolutely. Yeah. And it's also better to go and talk to the specialist and find that nothing wrong with you than just kind of thinking about it and being just distressed by not knowing is it normal or not. Also, another kind of important thing to evaluate is there is anything medical changed, right? Very commonly, I see women who've been on oral contraception pills for many years and they
Mhm.
notice that they desire, they're not the same, they not experience the same wetness that they had in the past. So it's also important to evaluate, okay, what pills are you on? What are you taking? Is anything changed? And review if we're going to continue on this medication if it's important, because again, unwanted pregnancy is the big issue. So you can't just like take someone off the medication. The question is, can we change for something or can we adjust something? And another important thing to understand that there are different types of desire. So there is spontaneous and there is a responsive. Spontaneous is very common among men. And the best way to describe it is I see the object of my interest and I really want to engage in sexual relationship with that person.
Okay, okay.
And responsive is when I'm not really into it, but as the situation evolves, as my partner makes advances, I'm actually getting interested and I'm getting aroused and want to have sex.
Okay.
And for women, it's more common to have a responsive desire. Again, nothing wrong with that. And
Yeah.
it's kind of similar to how you might feel like you're not hungry, but as you start eating, you're realizing the food is actually very tasty and you were hungry.
Yeah.
And again, in those cases, it's just educating women and explaining that again, it's normal. There's nothing
Mhm.
wrong with you that you just like not the same as your partner always want to have
Right.
sex.
Yeah, and I think one
Yeah.
of the things that I talk to my ladies about with that are more responsive is, having time by yourself. Feel what feels good to you, be alone, allow yourself that time to feel good, bad, indifferent, and then communicate that to your partner like, "Hey, when I was alone the other day, I realized that this really gets me going. So if you can start to incorporate that, that'll rev those engines and get them going." Or some women have to have communication throughout the day to get ready for nighttime, something like that. And that communicating that to the partner then can really enhance not only their connection, but her ability to get aroused and desire that sex.
Absolutely. And again, it's like because we're different from men,
Hmm.
for men it's just enough to like see a piece of naked body and we go good to go.
Yeah.
For us, for many of us, this kind of play starts in the morning when you start a
Hmm.
dishwasher, when you took kids to school. It's might be like depending on where you at life, there is different acts, different things that makes us
Hmm.
interested in
Yeah.
having sexual relationship. Some non-sexual touch is also very important,
Hmm.
and it's more important for women than for men. So it's very important, as you said, to have that communication and kind of explain that that's how our body works.
Hmm.
And that's how I would be more interested in having sex. At the same time, it's also, you don't want, like, you're not going to want something that doesn't feel pleasurable. So if you're not having good experience while having sex, you're probably not going to want to be engaged in sexual relationship in the future.
Yeah.
So it's kind of with a positive reinforcement. So that's where vibrators and all our tools come into place
Mhm.
that help us experience, like have a better experience. Using lube is very important. And there is actually a study been done that showed that when you use the lubricant, like the quality of pleasure you experience is
Hmm.
increases.
Okay.
The vibrators improve sexual satisfaction, let women experience multiple orgasms, and it just
Mhm.
makes it easy to kickstart the whole
Yeah.
process. So when you know what feels good to you and you can explain it to your partner, it makes it better for you and it makes it easier for the partner, because I truly believe that majority of partners, they want their partners to have a positive experience, enjoy
Mhm.
sex, and if they just have the tools and instructions, they will do their best.
Yeah. Yeah. And I think, the common denominator is in relationships is we want our partner to feel good and we want to feel good. So, if you're struggling to get that desire, your partner is going to want to give that to you because they want that intimacy. So I think that's so nice too, to know that, it's okay to communicate it because I mean, unless you're just with an asshole of a partner, they're going to want you to get off too, right? So like they want you to communicate that. It increases the whole relationship and sexual activity to communicate what you want, what you need to be able to fully participate and enjoy.
Absolutely. And I think that like that communication actually will take like more time and longer time.
Mhm.
You should spend more time talking about it
Yeah.
than maybe actually having sex itself, because
Yeah.
that's how important it is.
Yeah. And like you said, as we go through different phases, that conversation should be ongoing because what worked for me when my kids were little, now that they're grown, does not necessarily do the same thing. As someone who's postmenopausal and perimenopausal and early in their 20s are all craving very different things and their hormones are responding very differently to certain actions.
Absolutely. And some people feel like, oh, why would I need to do that? Why do I need to kind of like prepare it for sex?
Mhm.
And it becomes this kind of like a planned activity. But if you think about it, it's always been a planned activity.
Mhm.
Even when you were younger in your like teenage years, mid 20s, you still kind of expect that, oh, it's probably sex will happen. Like I'm going
Yeah.
on my third date. So you preparing.
Mhm.
And it just in a different takes a different shape. Before that, you like maybe not talking about it, just like shaving your legs, getting like
Yes.
putting on your sexy outfit. But now you like, okay, let's talk about it. Let's get our tools ready. Let's make
Yep.
sure we have like kids in bed and everything.
Yes.
So it's always takes preparation. And I think it's also similar to like, it's very rare when a good trip happens to you. Usually, in
Mm.
order to have a good trip, good vacation, you need to spend time planning and arranging
Mhm.
little things. So I think it's very similar to having a good sex.
Yeah. Yeah, that makes so much sense. Okay, so women go through the arousal, the desire, what's next?
So desire, it's the first stage. And
Okay.
then now our body needs to turn on, and it's a
Okay.
arousal stage. And in arousal stage, we kind of divide it into like three different arousal, like
Okay.
general arousal, where our heart rate increases, our temperature increases, heartbeat, our skin flushing. So basically the whole body participating in this response.
Mhm.
Local arousal is all the changes that happens in the genital area. So more blood flow again, brings more blood flow, more vaginal lubrication. There is more secretion from the glands. Vagina actually gets longer, like the upper one third of the vagina. And any additional stimuli, if you stimulate the clitoral area, kind of potentiate the response.
Mhm.
And the third arousal kind of area is our brain, to be able to stay like mentally engaged, mentally interested.
Sure.
And because it involves the whole body,
Mhm.
it actually shows you how important it is to have an optimal health in order to be able to produce that response.
Yeah.
For example, in men, there is a study that showed that if man has an erectile dysfunction, that actually precedes by 5 to 7 years of onset of the heart conditions. So
Mhm.
their erection is kind of a window into your cardiovascular health. For
Mhm.
women, it's also true with the clitoris. So if you're not able to produce a good enough like clitoral erection, clitoral arousal, it also can be a window into your cardiovascular health
Hmm.
and how well your health is.
Yeah, that's interesting because of course, I treat a lot of men with erectile dysfunction, so I knew that factor because I definitely recommend them to go to cardiology if especially if they're on the younger side and things like that. But it's interesting to, correlate that to women then too, that if they're just not getting that. So is that like the swelling and the sensation? Is that kind of what you're talking about? That if you're not getting that, you might need to go get checked out for your cardiovascular health?
Yes, and also
Okay.
with, there is the clitoris is so understudied.
Mhm.
So, and if you ask all the women, like, how often has your gynecologist looked at your clitoris? It's probably maybe you'll meet one who like
Yeah.
had the clitoris looked at. If there is any changes in, like, let's say, like how you feel, is there is any pain when you're getting
Mm.
aroused? We will talk about orgasm, but still, if your orgasm changes,
Mhm.
if it's become a little bit more muted, or it takes longer to reach an orgasm, or it doesn't last as long,
Mhm.
it might be indication that either something locally happening, like clitoral adhesions, clitoral phimosis,
Okay.
or if there is an issue with vascular health, that you just can't get enough blood flow
Mhm.
to have the same experience, which often happens in menopause. When there
Mhm.
is atrophy, the tissue is not the same, there is not enough blood flow, and a lot of women experience changes as they approach menopause and as they being postmenopausal.
Yeah. Yeah, I put a lot of my perimenopause and postmenopausal women on vaginal estrogen for that reason, that just keep that blood flow, keep that hormone because the atrophy is real. It's legitimate and it's not just sexually related. It's, frequency and urgency, burning with urination, just general irritation in that area. I will have women come in convinced they're having recurrent UTIs. But every single time they get their urine checked, it's normal. And I'm like, no, you have the genital urinary syndrome of menopause. Like we need to replenish you. And it makes a huge difference for those symptoms and the sexual health.
Absolutely, yes. It just you can't like I can't express enough how important it is.
Mhm.
And it often takes time to convince women that listen,
Yep.
estrogen, vaginal estrogen, not gonna kill you.
Yes.
It's just gonna help you.
Yeah.
And the problem is that a lot of women, they get to the point where the changes happen. The vagina is very dry. It
Mhm.
decrease like the diameter, the opening decreases, the vaginal length decreases, and there is like so much pain that
Mhm.
now we have to like start from like scratch. Give a lot
Right.
of vaginal estrogen and do pelvic floor physical therapy, use dilators, and
Mhm.
it can take pretty long time. So
Yeah.
if we can prevent that, it's the best.
Yeah, I agree. I think if I have women coming in during that phase and we get them started, they recover and rebound so much faster than my ladies who come in 70, 75, and are like, now I'm painful, now I'm doing all this stuff. And some of it is, their partner passed away and now they have a new partner. And so they just haven't been doing stuff. So they didn't even think about pain with sex or anything. And you're right, their vagina is smaller, their clitoris is atrophied, their labias are atrophied. And it takes months for them to get that back because they weren't on the vaginal estrogen. Whereas, other women who it's like, dang, that got better in a couple of weeks because I'm still making some estrogen and we got on top of it right away.
Yeah. And the same is true for our younger patient population who, for
Mhm.
example, again on oral contraception pills, and even on IUD, even though we consider it to be a local
Mhm.
contraception, I have a lot of patients who I check their hormones while they're on IUD and they
Mhm.
look like they have menopausal on the like hormone level.
Yeah.
So, and they do experience some changes. They might be a little bit subtle, but I think it's also very much we underestimate how
Mhm.
much effect even from the local contraception women experience. So I'm pretty routinely at like vaginal estrogen for someone who is on birth control. And
Okay.
another patient population is postpartum women, especially
Okay.
those who are breastfeeding.
Mm.
And in those cases, because frequently if women have like vaginal delivery, there is some tearing and
Yeah.
it also requires healing. And vaginal estrogen is so important for vaginal healing. And if you add lactation, the vagina is dry as a desert. You can't even think about sex. If you try
Mhm.
to have sex, it's going to be a horrible experience. So it actually makes it even worse with everything that else is
Yeah.
going on. So again, all postpartum women, majority of them, adding vaginal estrogen will actually help significantly.
Interesting.
Um,
Okay. I don't see a lot of postpartum women, so I don't have experience with that. So this is really fascinating.
Yeah, and I wish more like general OBGYN would be a little bit more liberal with giving vaginal estrogen.
Yeah.
It's not yet happening, but I'm sure it will soon, hopefully. But
Yeah.
it does create a huge, huge difference for women.
Yeah, that's amazing.
Yes, like vaginal estrogen is important because it helps to bring more blood flow to the area, and it
Yeah.
helps produce the enough lubrication, preparing women to being aroused, preparing
Yeah.
for like vaginal penetration. Also, there are other tools that are
Mm,
available, like vibrators,
mhm.
because we know that when we apply the vibration to the area, it dilates blood vessels. So more blood flow goes to the area. And we actually did a research where we gave women vibrators and asked them to use it 2-3 times a week for like 10-15 minutes externally, and
Mhm.
we assessed the pelvic floor condition, the sexual health, mental health, and then we did the same in 3 months. And we
Okay.
actually found that it significantly improved the sexual health,
Oh,
the satisfaction, arousal, orgasm, and it's improved the symptoms of like pelvic organ prolapse. It obviously didn't back organs, but it
right.
helps with the symptoms. And
Yeah.
interestingly, it's also improved the tissue quality. So vibrators is good for you. Using them will improve the lubrication, will improve the arousal and quality of sexual relationship. Pelvic floor physical therapy is also very important with the
Mhm.
same idea that it keeps the blood flow going in the genital area.
Yeah. Yeah.
Because if you think about it, if somebody had a trauma and let's say they broke their leg, we know that if you're not gonna exercise that leg, if you're not gonna get a massage, you're gonna develop atrophy.
Mhm.
And same is true with our pelvic floor, but nobody really talks about it.
Yeah.
And it's very important to keep the blood flow going, to keep exercising,
Mhm.
experiencing sexual pleasure so you can continue having it as
Yeah.
you getting older. So I know we probably talked a lot about arousal and there's like so many things about it.
Yeah. No, but it's fascinating. I love it. And it's so funny because, when I suggest pelvic floor physical therapy to some of my patients, they're like, I mean, like maybe later. Like I'm like, no, this is like first line therapy. Like you don't understand. This is the bomb. It's going to help you with your peeing. It's going to help you with your sex. It's going to help you with so much stuff. It is so important.
Absolutely. And I always said that to patients, but I never experienced it myself until I had
Mhm.
like my first baby via C-section and I felt like something like is off. And I went
Yeah.
to pelvic PT and I'm like, oh my God, it's actually so great. It's
Yeah.
similar to like going to massage, just
Yeah.
in a different areas. And it made such a huge difference in my life. So
Yeah.
now I think having that personal experience, I can actually speak to my patient about it, and it's obviously like I think you can hear that it's different when you're just
Yeah.
saying like, "Oh, go to pelvic PT," versus like, "Okay, I'm gonna tell you it's gonna change your life."
Yeah, it is. It's so life changing, and it's so interesting because, then I'll have people be like, well, I do the Kegels at home. Okay, that's like the least of what I'm talking about here. In fact, don't even do them sometimes. Sometimes they make things worse.
Exactly. Yes. I know it's another huge topic, but amount of patient that I usually tell to not do Kegels
Hmm.
is significantly higher than people who I would say like, "Oh, you will benefit from it."
Yeah. We
And
have
again,
people
I think
clutching their pearls right now, like, oh, how dare they say don't do Kegels?
yeah, but there's so much like pelvic pain due to those
Mhm.
like hypertonic pelvic floor.
Yeah.
And I think because it's not commonly talked about, women are very much surprised like about it,
Hmm.
like, oh, I'm too tight. I thought being tight is great. But again, and it's also like if you do a lot of Kegels, you have hypertonic pelvic floor, you have pain with sex, obviously you're not going to want to have sex in the future because it
Right.
hurts. And assessing pelvic floor is very, very much important. And going to
Yeah.
pelvic floor physical therapy is actually also about relaxing the right muscles, not only like learning how to clench it.
Yeah. Yeah.
And going back to our cycle, it's very important to have a good arousal because then it
Yeah.
prepares your body to experience great orgasm and also
Hmm.
prepares the body for vaginal penetration. So orgasm is the next stage. And with orgasm, again, we have like this contraction of the pelvic floor, this like release. And it's very important to also assess if there is any changes in like orgasm. If woman never had an orgasm, that's
Hmm.
one story. If she was able to experience orgasm and then suddenly something happened and it changed, it's a different story. Majority of people who never experienced orgasm, they will be able to have an orgasm with some education. There's a lot of women who don't know that the clitoris is the most important part. And even if some women who are able to experience orgasm vaginally, so you're still stimulating like clitoral
Hmm.
parts. Just education, introducing the vibrators will make them orgasmic. However, some women might have, again, clitoral adhesions that not letting them experience orgasm. And
Hmm.
some people actually very, very challenging and difficult to make them orgasm. So I always prefer patients who like had their orgasm in the past and then something changed because I know
Yeah.
I can bring them back to what they experienced. But when somebody never experienced orgasm, it can be very, very challenging and can
Yeah.
take some time.
Yeah.
Again, going to the back to the biopsychosocial model, there might be not only something physical going on, but also going to sexual therapy, helping to learn if it's something that you experienced in your childhood, something that you know and believe in. Changing that can take a long time.
Hmm.
But it's all doable. And the women who had the orgasm in the past and something changed, again, we're evaluating what happened physically, emotionally, doing a thorough exam if we can change anything.
Yeah. And medications too, because there are some medications that affect orgasms.
Absolutely, yes. And there is a lot of medication that people being placed on without actually being told that it can affect the sex drive and orgasm, and arousal, obviously.
Mhm.
And some medication, for example, right now there is emerging data about GLP-1 medication that some people noticing that the orgasm is not the same.
Mm.
So there is more research to be done, but that's
Yeah.
definitely something that I'm very looking forward to like learn more about.
Yeah.
Uh, there's statins that can affect the ability to, like, basically libido and ability
Mhm.
to experience orgasm, beta blockers, SSRIs.
Mhm.
So it's sad because women, when they learn that they've been taking medication that affecting their sex drive and they didn't know, it's very disappointing and sad.
Find that women, even, we talked about having some alone time just to learn some desire and some arousal and things that work for you. Do you find that your women who are willing to explore and have self-care time as well can figure out what works for them orgasm wise and end up having better orgasms with their partner then?
Yes. And it's very important because if you don't know what works for you, like how would your partner know what works for
Mhm.
you?
Yeah.
So, and I think it's both. Not only like, let's say, work with the vibrators, it's also expanding your erotic library that some
Yeah.
people can do it with like pornography. Some people listen to the erotic stories. There is really good apps. And I actually had a patient who she would listen to the erotic stories on her way from work. And by the time she gets home, her and her husband would have sex, and then
Mhm.
have dinner. And it worked
I
for
love
them
that.
because
Yeah.
it kind of like warms you up.
Yep.
Um, and again, it's similar analogy to food. If you start
Yeah.
thinking about food, what you want, what you don't want, you kind of like get into the mood and like, okay, I'm hungry now.
Yeah. Yeah. No, that's such a great point. And I have, I love the listening to erotic novels and erotica and things like that. I actually had an episode with an erotic novelist on here and how she talked about that worked for her. And then that got her into, wanting to write that for other people. And I have several friends that really works for them. And I think it's so great. I also love the whole sex before dinner because how many of us do not feel sexy after dinner? And I tell for my guys too, like with their ED medicine, Viagra needs to be taken on an empty stomach. I'm like, take it, have sex, then go out to dinner and have a good rest of your night. I love that. I love sex before dinner. It's a great way to do date
And
night.
again, it's just like For some reason, there is this like stereotype that you get
Mhm.
ready, have a dinner, and then you come home and have sex. But
Yeah.
yeah, majority of people feel like full tired and like, let me go to sleep.
Yeah.
But why don't we switch things around? The
Yeah.
important part happened, and then you can enjoy your dinner.
Yeah. Well, and especially like I always feel my best when I'm getting ready to go out to dinner or something and I'm got my music playing and I'm doing my hair and my makeup and all of the things. So you're already getting that, desire and arousal going because you're making yourself feel good. And then it kind of just goes right into being sexually active.
Yes, I can't agree more.
So I know that there are women that, like you said, struggle to ever get an orgasm. What are some things that you kind of specifically give them as homework to try and figure out? We've ruled out medicines, we've ruled out major trauma and stuff. Now we're like ready to get them their orgasm.
You're referring to women who never had the orgasm?
Correct.
Yeah.
Yes.
So, I mean, obviously, you rule out everything physical, medical, and then it basically like a trial of error.
Mhm.
Unfortunately, there is no like a strict guidelines. Okay, this is
Yeah.
the step one, step two, step three. So there is, you can, first of all, go home, watch porn, find out what you like, what your
Mhm.
preference like. There is a really good website called OMG Yes. That you probably heard about
Yes,
that.
I love it. It's fantastic.
Yeah, so kind of like make sure that they're doing things right. And again, we talk
Mhm.
about it in a clinic, but again, sometimes those topics are a little bit easier to comprehend without like this like stress in your head when you're alone
Yeah.
with like your screen versus me as a physician telling you like, okay, do it this way or that way.
Yeah, exactly.
So, but we definitely like touch base about that.
Okay.
If you never had like owned the vibrator, I usually recommend a few that I believe would be really good. They have like a good motor, they
Mhm.
quiet. Definitely try and see what you like better.
Mhm.
Then, if we go towards the medication, sometimes the issue, like again, a lot of people have attention deficit disorder. So we
Mhm.
work with adjusting the timing of the medication. It's
Okay.
actually it's been shown that if you take your medication, like Adderall, let's say, and you start self-exploring within like a couple of hours, you're going to have a better result because you can
Mhm.
also kind of stay focused. On the activity that you're doing. Some women, they also have an issue with desire that affects the orgasm. You probably heard there is two medication that FDA approved for
Mhm.
hyperactive sexual desire disorder. So
Mhm.
basically women who due to their chemical disbalance in their brain, they affect them significantly. And there are two medication that work on those chemicals, the balance, and help to be desire
Yeah.
sex, have a better libido. It would be off label to prescribe them for orgasm,
Okay.
but actually in my patients, I found that, for example, prescribing flibanserin or Adi, little
Mhm.
pink pill, helps them to get into this like more relaxed, like mood, staying in the moment,
Mhm.
kind of like shifts this focus from like, okay, I need to be able to experience orgasm to like, let me just enjoy it and see what
Yeah.
happens.
Yeah.
Again, there's no really studies have been done that showed that,
Mhm.
okay, Adi will help with orgasm in particular, but in my patients, I noticed that it actually helps them a lot. And if it
Yeah.
helps, like, okay, there's so many things that we still don't know, and if we're not
Right.
gonna try, we never gonna know. Also, the another medication that for indicated for hyperactive sexual desire disorder is Valisi, bremelanotide. It's
Mhm.
injection.
Okay.
And what I find with injection, it works a little bit like stronger. Like
Okay.
when I explain to my patient, when you take the Addy, it kind of makes you feel a little bit more mellow.
Okay.
And Valisi is a little bit more like, I want to have sex. Like, give it to
Okay.
me now.
Got it.
And for some people, it's actually worked better because they don't want to think about having an orgasm during the week, but
Mhm.
on the weekends they have time to do self exploration and actually giving yourself that injection and staying in that mood can help.
Okay.
So there is also Viagra. Again, it's all off label treatments.
Mhm.
But some women notice that it helps them feel more and the
Mhm.
orgasm are getting stronger. So why not try it on the women who never experienced orgasm? Because
Right.
again, Viagra worked on the erectile tissue in the penis, and we have erectile tissue
Mhm.
now, clitoris. So why not to try?
Yeah.
Some women experience improvement with oxytocin that you can prescribe topically, and you can prescribe it also as a like intranasal spray.
Okay.
Also helps to kind of like relax, get you in the mood, helps the tissue.
Mhm.
All of this, again, experimental off label, but when we work with a problem that we don't have the exact algorithm of like what to do, you kind of
Right.
have to be creative.
Yeah.
And with those patients, you never know what exactly will help.
Yeah. Yeah, for sure. No, that makes so much sense. All right, so we've got our ladies to climax. They get their orgasm. There's one more phase we haven't talked about.
Well, they can also have another orgasm.
Well, this is true too. Keep going, ladies. Enjoy it. It's my favorite thing.
Exactly. And
Please don't stop at just one with me. I'm going to need more.
if we have that ability, why not use it? Guys
Right,
can
exactly.
do that.
Yeah, I need lots of stress relief, not just one.
So yeah, and then everything kind of goes back to normal and same similar, basically like relaxation, going back to normal. That's the only thing
Yeah.
I can say.
Yeah. Yeah. No, that makes sense. Yeah, and I think it's important to point out that we can have the multiple orgasms because for men, that's much more difficult. There are a few unicorns out there that get this wild ability, but we don't have that refractory period to the same degree that men do. And so we can have the succession of orgasms. And I always challenge women to go and make sure that you're getting multiples because it's fantastic. And, in the recovery phase, as you're getting back to normal, and that's kind of where we're feeling those lovey dovey feelings. We want to snuggle a little bit. We get up to go pee and clean ourselves up, all the things. But I think, that phase is just as important to allow ourselves to feel it and to relax. And also, I think to look back on that session and be like, what did feel good? What didn't feel good? Especially if you struggle with climaxing. Like, I got to climax this time. Let me like write down in my journal everything that happened so I can recreate that. And I think it's such an important phase that shouldn't be overlooked.
Absolutely. And it can create like this positive or negative like aftertaste as well. So and again, everyone is different. For some people, as you said, it's very important to feel like lovey-dovey, let's snuggle. And for
Mhm.
some people, like, you know what, I just want to sleep. And again, communication is very important. So if it's important for you to be snuggled by your partner, like make sure you say it. Because if you have an expectations that haven't been fulfilled, that can make your experience not as positive, and then
Mhm.
your brain, your body will remember it for the next time.
Yeah. Yeah, that makes sense. Yeah, phenomenal. You have brought such great information today. Like, I have loved this conversation. This is so amazing. Do you have any last minute tips or anything that you really want to drive home to the listeners today?
Well, I think we should really assess our sexual health as we would assess any health concern. So if
Mm,
there is any concern, it's always better to bring it up with your
yeah.
physician. And I know like then there's a question which physician we would go. Are we going to go to primary care, gynecologist? How we're going to bring it up in like our 10 minutes visit? But again, you can always send a message, say, hey, I have an issue with sexual health.
Hmm.
Let's schedule the appointment. Let's schedule like telehealth.
Yeah.
And if the person can help you personally, they might be able to refer you to the specialist like myself
Hmm.
or my colleagues who help women who has a sexual concerns. Because again,
Hmm.
life is too short to have bad sex or
Yeah.
just living with the issue and not resolving it. So if there is anything, majority of things we can treat, we can
Hmm.
improve and make it better. So I would say speak up. Don't like suffer in silence, and there are people who can help you.
Yeah. I love that. Don't settle for bad sex. Get help. I love that. That's so perfect. Thank you so much for being on here. It has been such a pleasure of mine to have you. You have dropped so many great, solid nuggets of information for us. And for the listeners, in the show notes, we will put her website as well as social media so you can connect and follow her. I love following her on Instagram. She has amazing videos and some good tips and tricks that I've learned things from too. So it's good for all of us. Thank you so much for being here.
Thank you so much, Stephanie, for having me.
Absolutely. It's my pleasure. Have a great day, everybody. Go get between the sheets. We'll see you next time. Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening, and go have some fun between the sheets.